Bipolar disorder is a complex neurological disorder influenced by the interaction of genes and environment. Bipolar disorder is characterized as a significant shift in activity, mood, relationship maintenance, and ability to do everyday tasks. The etiology can mostly be attributed to neurotransmitter dysregulation in serotonin, dopamine, norepinephrine, and GABA neurotransmitters. Abnormalities in the prefrontal cortex, amygdala, and hippocampus are also key factors of susceptibility to BPD. There are two primary categorizations of BPD that vary in symptoms and how they overall affect the livelihood of the individual. These classifications better help clinicians to distinguish symptoms and its severity, as well as make accurate diagnosis for the individual. Whether the patient experiences mania or hypomania and its respective timeframes critically affects the diagnosis they will receive from a clinician. Bipolar 1 disorder is mostly characterized by manic episodes involving elevated/irritable moods, risk-taking behaviors, depression symptoms, and elevated grandiosity. Bipolar 2 disorder generally consists of one major depressive episode and one hypomania episode. However, mania does not occur. According to the DSM-5 criteria, mania is defined as a period of time where irritable moods and abnormal behavior involving increased energy and activity surges from the individual. They must experience 3 or more of these symptoms to meet the bipolar 1 disorder diagnostic criteria. They must experience 3 or more of these symptoms to meet the bipolar 1 disorder diagnostic criteria. They must experience these manic symptoms for 7 days minimum, which consists of increased grandiosity, decreased sleep, increased risk behavior, experiences flight of ideas, more talkative than usual, and in severe cases, experience psychosis, which includes delusions, false beliefs, or hallucinations, mostly consisting of incoherent behaviors. In addition to this, they also must experience depressive episodes lasting for 2 weeks minimum. On the other hand, bipolar 2 disorder is mostly defined by not as recurrent depressive episodes and experiences hypomanic episodes rather than manic ones. The patient must experience depressive episodes and one of these hypomania symptoms lasting a week. Time periods where abnormal behavior is exhibited from the individual, including irritable moods and increased energy/activity for 4 consecutive days. Uncharacteristic change in functioning. Not experience psychosis, because that would be considered mania otherwise, and not severe to the extent that it has caused impairment to the social capability or hospitalization of the individual. A lot of what society perceives of individuals with BPD is often misconstrued in the media, as these portrayals are often associated with violence, unpredictability, and involvement in crime. They are often shunned in the eye of the public since there is unfortunately a lot of prejudice towards people with mental illness. People often tend to fear what they don't understand, as well, exacerbating the negative perceptions around those with bipolar disorder, such as the etiology. Here are some myths surrounding the causes. 1. Substance abuse causes bipolar disorder. This is not true. While substances can worsen the symptoms of BPD, it does not inherently cause it, as some may believe. It's the interaction of genetics and environment that can increase the prevalence of BPD. Number 2. BPD is just mood swings. While everyone experiences good and bad days, this is not the same as bipolar disorder. Individuals with BPD often experience extreme highs or lows in mood that can range from days to a month, with or without the stimulus necessarily triggering it. Number 3. Medication is enough to mitigate symptoms. BPD is a lifelong chronic disorder. There will be periods where symptoms are particularly high or vice versa. The best integration to handle BPD is to maintain a good, consistent sleep schedule, healthy diet, utilization of mood stabilizers, and using cognitive-based therapy as mitigation practices. Number 4. People with BPD are inherently violent. People with BPD are more so irritable and impulsive that can lead to aggressive behaviors. They are not, however, inclined towards violence, but rather comorbid substance abuse and various environments that are triggering can influence aggression from the individual. The likelihood of getting bipolar disorder is increased when you have a direct family member, such as a parent or sibling, who also experiences BPD. Another risk factor is emotional distress, such as childhood trauma involving neglect and abuse. These experiences to a young developing youth can have brain-altering chemistry that can result in abnormalities in GABA neurotransmitters. GABA is an inhibitory neurotransmitter that acts as a brake in the brain to calm the brain from neuron firing. Hence, when individuals with bipolar disorder experience manic episodes, studies have shown that there is decreased GABA levels in the person's brain. Some of the best ways to help people with bipolar disorder is to listen and be patient within your capacity. Remember that it is not your responsibility to ensure the welfare of others outside yourself, but you can definitely try to help while placing healthy boundaries between you and loved ones. Societally, we need to acknowledge that if people do experience mood or manic episodes, it is not reflective of their character but a symptom of their disorder. According to the World Health Organization, 1 in every 2 people will experience a mental illness of some sorts, meaning that mental illness is a lot more common than people think it is. Also, 1 in 150 adults live with bipolar disorder, meaning roughly around 40 million people live with BPD throughout the world. Women are more often diagnosed with it compared to male counterparts due to gender bias, even though studies show that prevalence rates are more so 50-50 than the latter. It is considered one of the leading causes of disability, since it can result in strained relationships and difficulty in professional and everyday settings. Unfortunately, up to 40% of individuals can also be misdiagnosed with PTSD, ADHD, or even depression instead of BPD, emphasizing the idea that it is more common than others perceive, and that we should use knowledge to eliminate stigmas and fear of what we do not know.